The thing with a lot of synthetic androgens is these are drugs from the 70s and 60s. Okay. When the pharmaceutical companies were developing them, they were developing them with the idea that, okay, we need to replace testosterone. Because, for example, in the 1950s and 40s, women with end stage renal disease got testosterone propionate as a treatment for their end stage kidney disease. Why? Because end stage kidney disease causes your red blood cells to drop precipitously. There's a complex reason for that. I won't go into explaining that, but though women in the 1950s got testosterone propionate, and it caused masculinizing effects. So deepen their voice, facial hair growth. It caused a lot of like unwanted negative side effects. So the synthetic androgens were designed in part to reduce the side effects of testosterone in women, but also in like children and little girls and things like that. And largely the drugs failed because they were just so unsafe. They could never, they see, the thing is that even with, you've heard of SARMs, selective androgen receptor modulators, which are not steroids, but they act like androgens. Okay. They could never really isolate and find substances that worked as well as testosterone, but with less toxicity. Testosterone has side effects, causes you to retain water. I mean, can cause transient moodiness. It has side effects like every drug, right? They could never find anything that was better than testosterone. They really couldn't. They could find stuff that was less masculinizing, that women could tolerate better. But what eventually happened is, like in the 80s, they discovered erythropoietin, which is the hormone in the kidneys that controls red blood cell production. So they started giving women with chronic kidney disease erythropoietin, because then, they avoided all the masculinizing effects. But the thing people need to realize, and I guess the whole point why I'm going into this, is anabolic steroids, not testosterone, but other synthetic androgens, are mostly just failed drugs. There's a reason why they're not used commonly, because they're very toxic. That's the main reason. And if you're a young person, by the way, if I'm a doctor, I could give you a prescription, and you could take that prescription to whatever equipment you have in your compounding pharmacy. I'm sure it's all sterile and safe and whatever. These guys getting this shit online don't get that kind of quality.
Exactly. I mean, and that's Dr. Bronson, when I see a gym rat or a meathead on TikTok or whatever social media, educating people about trend and D-ball and all this stuff, it just wants to make me throw up. It's like, why would somebody trust a meathead in the locker room of a gym to sell them stuff? And it really, the culture is just, it really infuriates me. And that's why I wanted to do this podcast.